Welcome back, everyone, to my YouTube channel, which is called New Some. And I hope the videos that I do make for you, that I try to summarize it as much as possible in short. I hope they are enjoyable and precise for what we want to know. So for today, it's related to COVID, but it's actually kids. And recently, more and more scary stories are coming out that children are actually developing rashes, cardiac abnormalities, and other inflammatory symptoms that are linked to the coronavirus. So parents and public health officials are very much worried, but overall, for now, it's a very low risk in children. So last week, the Centers for Disease Control and Prevention stated that in the United States, 15 children under the age of 15 have actually died of COVID-19 since February, compared to about 200 who died of the flu and pneumonia. So this means overall children appear to be 0.02% of virus deaths in the US, and very few have been hospitalized. So just last week, a study in the Journal of the American Medical Association said that pediatric doctors have found that only 48 children were admitted to 14 pediatric intensive care units in the U.S. between the period of March 14th and April 3rd, and 83% of those had a chronic condition. So the death rate among children in ICUs was 5% compared to 50 to 62% for adults. Another new study in Journal of American Medical Association examined that children who were treated for cancer at New York's Memorial Sloan Kettering Center, 20 of the 178 pediatric patients had tested positive for coronavirus, an infection rate of 11.2%, but only one had required non-critical hospital care. So out of their 13, of their 74 adult caregivers also were tested positive, an infection rate of 17.6%. So the authors of this study in conclusion said, "Together, our results do not support the theory that children are hold of unrecognized COVID infections." So based on population antibody studies, children also seem to be at a lower risk of infection. So for example, we looked at Spain, and in Spain, just 1.1% of infants under the age 1 carried the antibodies. 2.2% of those between ages 1 and 4 carried, and then 3% between ages 5 and 9, 3.9% between ages 10 and 19, and for ages between 20 and 39 were 4.4%. So antibodies were the most common in the people of Spain for ages 60 and older at the percentage of 6%. So scientists, they're so confused over these age inconsistencies. One theory is that children have stronger natural immune response that allows them to quickly clear up the virus without developing antibodies. Another theory is that the virus may not hold together as easily in children's nasal passages that are actually the main entryway for attacking the body. It's also possible that children have protection against a viral infection from earlier coronavirus causing common colds. Related to this, 2 new studies have actually found that antibodies in white blood cells that individuals develop to fight recent cold infections, they also react against the coronavirus. So unlike with any other respiratory viruses, children do not appear to be large spreaders. Australia's National Centre for Immunisation Research and Surveillance tracked that the coronavirus cases at 15 schools from the period of March 1st to April 16. So the outcome was that 18 people were affected. And after 6 weeks, only 2 of their 863 close contacts at the schools had become infected. So this means that there were no cases of students passing the virus to teachers. Students also from China did show that kids were more likely to pick up the virus from their parents than vice versa. So, we know that all schools and colleges, universities, they're all closed for the remainder of the semester. But how will conditions be like in a few months if the students have to go back to schools physically. So parents and public health officials are now nervous about reopening the schools because in the hotspot areas, some children are appearing to have fevers, rashes, and inflammatory symptoms that are very similar to the Kawasaki disease. Now, the Kawasaki disease was discovered in Japan about half a century ago, and its cause is still unknown, though it has been found to follow infections. So the syndrome does affect 20.8% of 100,000 children in the U.S. under the age 5, which is about 4,800 cases each year. So last week, a study in the journal Lancet stated that 10 children came up with that inflammatory syndrome in Bergamo, Italy. Now, Bergamo in Italy is the city with the highest rate of death and infections, like about 30 times higher than the normal rate. And most of them were all older, and they suffered more severe cardiac symptoms than those that typically found with Kawasaki. But the authors also estimated that likely no more than 0.1% of children who had been exposed to the virus were affected. So all hospitalized patients had been discharged, and the authors did recommend treating the patients with steroids to calm their immune systems. Now, during these times, parents and doctors need to be especially observant. But as a society, we also need to keep in mind that the risks to children from the coronavirus are small, especially compared to others. Now, the Foundation for Research and Equal Opportunity predicts that children under the age 15 are 6.83 to 20.07 times more likely to die of a flu or pneumonia than actual coronavirus symptoms. So all of this supports for more study, and nobody wants to harm children. But the risks to children are not enough to justify the continuing destruction of the lockdowns. I hope you guys enjoyed today's article. It's a very hot topic now that the COVID is appearing, the COVID symptoms are appearing in children. So let's all be safe, and please maintain the social distancing. Thank you.